Good afternoon. If there is any one piece of news that has been particularly devastating during this COVID-19 pandemic, it is the shocking toll that the virus has taken on the elderly. Every day seems to bring ever more disturbing reports of seniors dying of the effects of the coronavirus, either in their homes or in public and private seniors' residences. It has made for terrifying times for the senior citizens in our communities, as well as for their caregivers, the children, spouses, and friends, who are often left helpless in their bid to protect their vulnerable loved ones from this invisible enemy. Welcome to this special edition of our series of McGill alumni webcasts, Caring for the Elderly During COVID-19. It's Tuesday, April 21st. And my name is Derek Kassoff, Managing Director of Communications at McGill's Office of University Advancement. And today I'm joined by three of McGill's leading experts in the areas of aging, geriatric medicine, and caregiving, as we explore the effects of COVID-19 on seniors and their loved ones, the caregivers. With us today are Dr. Serge Gauthier, professor in McGill's Departments of Neurology and Neurosurgery and Psychiatry, and director of the Alzheimer's Disease and Related Disorders Research Unit of the McGill Center for Studies in Aging at the Douglas Hospital. Welcome, Dr. Gauthier.
Bonjour.
Dr. José Moret, professor in McGill's Department of Medicine, director of the Division of Geriatric Medicine, associate director of the Quebec Network for Research on Aging, and past president of the Canadian Geriatrics Society. Welcome, Dr. Moret.
Hi, everyone.
And Mrs. Claire Webster, founder and ambassador of the McGill Dementia Education Program and a certified Alzheimer care consultant. As a former caregiver to her late mother, she has had firsthand experience in dealing with the overwhelming emotional and physical impact that is placed on family members. Welcome, Mrs. Webster.
Thank you.
Not only are all three accomplished experts in their fields, but they are also the driving forces behind the McGill Dementia Education Program, an initiative geared to educate family and professional caregivers. So welcome again to all of you. And speaking of educating caregivers and the public, that is exactly what we hope to accomplish over the next hour or so. So thank you all of us for joining today as we work to bring some insight and guidance to one of the more worrisome angles of the COVID-19 pandemic. As you might imagine, we've received dozens of questions ahead of today's webcast, far more than we'll be able to tackle today, but I've selected those that represent some of the major concerns we are hearing from caregivers. But before we dive into some of those questions, perhaps we can begin by asking our experts to describe how dire the situation really is right now for our seniors, particularly those who are unwell and suffering from either physical or mental illnesses. Dr. Moret, can you describe for us the particular health struggles that seniors are coping with during the COVID-19 outbreak as compared to younger population groups? We know that a typical strain of influenza affects the elderly in disproportionate numbers, but why does COVID-19 seem to be so particularly damaging to our seniors?
Well, I mean, most seniors would cope very well because as with age, we have more experience and our resilience enables one to respond adequately. The struggles are with those who have either functional difficulties for their self-care, or those who are suffering from dementia because their coping capacities are diminished. This is the type of population that those who are vulnerable suffer most from what our health authorities have imposed on them to stay in their homes, to follow the physical distancing or social distancing, which is different from social isolation. And I think we're going to have to discuss this.
Okay, thank you for that introduction to this. Dr. Gauthier, maybe I'll turn the next question to you. Seniors' residences seem to have been hit particularly hard during this pandemic. Why have these homes become such hotspots for the virus? And why were staff and public health authorities unable to contain the spread?
Well, I listen to the news as much as you do, the listeners to this webcast, and our understanding about the virus has evolved over time. This was discussed in previous webcasts by infectious disease specialists, so I will refer people to those previous webcasts. But my understanding for this specific question you raised is we didn't know that asymptomatic carriers are contagious. And some of the family members and later some of the staff probably brought the virus into the nursing home or residence. Then you have people living in a small environment. Claire probably will want to add to that, just a physical, it's like being on a cruise ship on the ground. you have limited space and limited ability to separate people who are COVID positive and those who are negative.
Hmm. So, Mrs. Webster, this must be such a difficult time for those among us who have loved ones, either living in seniors' residences or self-isolating in their homes. How can caregivers manage the sadness and helplessness they feel from not being able to protect or even visit their loved ones during this time?
Well, first and foremost, I'd like to say that my heart goes out to everybody all the family caregivers who are currently going through this situation. I lived through it for a period of 13 years with my mother, half of which were in long-term care facilities. And these are unprecedented times right now. For the families that have a loved one right now in residences, the first thing I need people to know is please don't play the guilt card with yourself. A lot of people feel guilty saying, this is my fault. I shouldn't have had my loved one transition there. Nobody could have predicted that such a pandemic could have happened. And as a society, we put faith in our healthcare system and we trust in the healthcare system. So what happened was totally unprecedented. The second thing I'd like to say to all families is because of your grief and what you're going through, you need to seek out support services. This is not something that you can navigate on your own. You need to talk about how you're feeling. You need to reach out to local support groups. We have our resources listed on our website, the Alzheimer's societies and Alzheimer's associations and all of the organizations, but you need to seek out support. And I also think that information is key. So what's happening right now is that there are a lot of family members who are panicking and are calling multiple times a day and emailing and texting and really panicking and trying to get information about their loved ones. And they are entitled to receive this information. However, we have to understand that the healthcare system is overloaded right now. You want to create an alliance with somebody at the residence who can answer your questions, but you need to stay calm. And I know this is hard, but you need to remain calm. And you need to understand that they can't call you back 10 times a day. So it's really important to just be calm and how you approach these people and speak to them. And finally, for those people who are caring for a loved one at home, education is key. You must become as educated as possible on the disease and understand what's coming next to be prepared. You need to understand, become educated. You can't care for somebody at home without knowing what's coming next.
Great. That's all some terrific advice there. And I think we're going to have an opportunity to get into many of those issues in greater detail, in particular, the piece about understanding what is happening to our loved ones, particularly those who have dementia. Before I let you go, Mrs. Webster, just another question for you right now. We're not letting you go at all, Marie. But can you talk to us a bit about the concept of anticipatory mourning? The sense that
Yes.
caregivers are in a constant state of mourning throughout this entire journey as they witness their loved ones in various stages of decline. And how has this current pandemic exacerbated these feelings of despair for many?
So, I only understood this concept of anticipatory mourning a couple of years after my mother had passed away. First of all, caring for a loved one with dementia is considered as causing one of the highest level of caregiver stress as compared to any other disease, because you are constantly in a state of witnessing the evolution of the disease. You're kind of like losing your loved one all along the way. So at the beginning, it's very cognitive. You're losing your ability to communicate with them. You're watching them lose their, just basic activities of daily living, things that they used to do are not able to do. And then as the disease progresses, you're witnessing the physical decline. And what people need to understand that each step of the way, you're mourning a loss of their autonomy, you're mourning a loss of who they were. And so it's important that caregivers understand this, that they be gentle with themselves, and even one more reason to really seek out support services for their grief, because you're not just grieving at the end, you're grieving from the moment that you receive this diagnosis.
Great. So let's turn now perhaps to some questions that have come in from the public over the last few days. Please take note that I have removed the names of those who have described very personal situations to us, including this first one, which is a question I think that speaks to a concern that's currently on the minds of many who have parents or in-laws living in seniors' residences. It's a bit long, so bear with me a bit, but she writes, my mother-in-law just turned 94. We were, however, unable to celebrate with her. She's in a seniors residence in her own apartment, but we cannot see her. We are her only line to the outside world. She does not have internet, so we are considering buying her a tablet and setting up FaceTime, but uncertain that will even work. We are at a loss as to how to help her feel loved and not alone. We have also started prepping a room for her on our own main floor in our own home to potentially move her in with us. What are your recommendations?
Maybe I'll
Dr. Moret, go ahead. Yeah.
please.
Well, two things. There is minimal things one can do so that the loved one in a nursing home residence is not isolated, and there is other than the usual technology-related ways of communicating. You can phone every day to make sure that your loved one is in contact with you. You can also have a body inside of the residence that could be closer to your parent, your loved one there, so that they can send you news about how the person is doing. But if you think of bringing your loved one at home, there is many considerations to take because depending on the level of support care that person needs, it could be highly risky to take this person within your own home. This involves the services to be provided, has to take into consideration if they can feed or not by themselves, if they can mobilize by themselves, if they can control their bladder and feces as well. So this is important because you would need to have recourse maybe to a home care helper, and this puts also the house in danger of getting contaminated, getting COVID. So all of this needs to be put into perspective before taking such a decision. And to help you, there is at the Canadian Geriatric Society a document in their website helping caregivers to assess if they are ready or not to take their loved one home. So this is an important resource that we'll make available in our document of the dementia.
That's good advice. I appreciate it. You're obviously not able to provide a specific answer to every case. Dr. Gauthier, I know you want to jump in as well. I'll turn to you, but if you want to answer as well. But I guess the other question is, has there actually been any guidance offered by public health authorities in any jurisdictions in terms of pulling residents out of seniors' homes at this point and bringing them to live with their children?
Jose?
I don't think that there is any public health authority who have proposed any document, but we have one posted in our Canadian Geriatric Society website. In fact, it was a work developed by researchers and professionals from University of Ottawa, and this have been adopted by the CGS, the Canadian Geriatric Society. So this is a good document because it puts into perspective the needs of the person, what you need to provide, and how strong you feel that you are capable of doing it. You need to take this all into perspective.
Mrs. Webster.
So I would like to jump in and say that, unfortunately, the majority of caregivers or family members have not been properly educated on the disease. So when they get a diagnosis of it, as compared to the diseases, the family isn't automatically informed about exactly what is involved. And so, safety is a paramount issue. So a lot of people may say, well, I want to bring my loved one at home, but if they don't know how to safe-proof properly their home, the risk of falls could be as great to their loved one as if they were to remain in a residence right now. So as Dr. Moret mentioned, it's not just a cognitive disease, it's a physical disease. And as the disease progresses, the demands on the caregiver will amount to 24 hours a day, 7 days a week. And so for people who are considering bringing someone home, you have to be mentally and physically prepared to take on this task.
So the next question, it's similar, but it sort of touches on this issue of, is a senior more likely to be infected in a home or with people coming into their own home? So let me just get to this. It's a woman who says that her 89-year-old husband has been in hospital for 1 month following a serious illness. Lung problems, not COVID-19. He will be discharged this week and is expected to go to a rehab center. She's concerned that he would be vulnerable to catching COVID-19 in a rehab center. The alternative, of course, is having physiotherapists and other caregivers come to their house, which may be dangerous for both of them. unless the workers are fully suited up against COVID-19. And she's wondering what would be a best solution to consider in this situation. Dr. Morin?
Yeah, maybe I could say something. This scenario, which is the reality that most people are living, transpires, the difficulties with this COVID pandemic. There's a lot of suffering, a lot of situations that are tearing. But one has to see what objectivity, what needs to be done. And certainly this person would need to have rehabilitation. The question between going to a center versus home, in both situations, there is risks. There is no situation without risk. One has to consider that you would receive maybe more attention, more physio, more rehabilitation in the center than at home. And if he receives rehabilitation at home, this physiotherapist, this occupational therapist, is not only taking care of that person, will be on other homes and maybe working in the centers as well. So the risk is there. And, early on this pandemic, many of these rehab centers or residences were not prepared. They were not trained. They have not received the directives how to proceed. It's not the case anymore. So my recommendation is I would recommend that the person goes to a rehab center the way they are now being organized. It's safer, probably.
Okay, thank you. So I'm going to jump to another one which came in. It's a similar situation, and then maybe we can move on from this topic. But this one came in from a woman who says her parents are in their own apartment. Her father is 97 and receiving home care daily through the CLSC for bath and personal care each morning. Given that these home care workers are going to several homes each day, and that there is not one consistent caregiver for her parents, what is the risk of her parents contracting COVID-19 from one of them? And does it make sense at this point for her to cancel the home care?
Maybe I could
go ahead.
start and then the others could fill in. But the reality is that there is a need to care, professional need. And there is also precaution all of us needs to take, including this helper that is going on regular basis. So I would recommend that the caregiver verifies that each time the helper comes to the home, that this person washes the hands, that he wears a mask, that there is a minimum contact, and the caregiver, the spouse, or should respect the distance and just allow the person receiving the help with this helper. And these measures help for the most cases. At the same time, the public health authorities are aware of the risk, and there is efforts being made so that there is always the same helper going to the person's home, and they don't send anymore 3 different helpers per week, let's say. This can conceal a bit more the risk of contamination.
Mm-hmm. And it's probably more helpful as well from a, I guess, psychiatric or psychological point of view as well, to have the same people coming on a regular basis, regardless of there being a pandemic, I would imagine.
Oh, definitely, because you establish a relationship. These helpers, they become like a family member when it is always the same person. And there is an increased awareness that this is what we should be doing now and in the future as well, if we are capable of increasing the resources available.
Great. I'd like to turn our attention now maybe to some questions we received about seniors who are still living independently in their own homes. The first one here is from Kathleen Duras, who's a geriatric nurse practitioner working for the Department of Veteran Affairs in Brooklyn, New York. She's asking, how can homebound elderly be best supported to safely remain in their homes? And what are some best practices for community-based care?
That's me, the senior.
Go ahead, Dr. Gauthier.
So you will read general advice about that on different websites. Surprisingly, the Alzheimer's Society of Canada has on its website advice for caregivers, but meaning healthy seniors. And having a routine is important. Having physical exercise regularly. You can cook. I'm learning to cook even things I've never done before. Contact with the children and grandchildren, so Skype twice a day. Healthy seniors, as José was mentioning, there's a resilience, and if we're healthy, we're lucky because we'll go through with this.
Great. It sounds like you were speaking as much from personal experience than medical experience. We appreciate that.
Yes.
I do want to ask you, Dr. Gauthier, though, when it comes to caring for seniors who are suffering from Alzheimer's or other forms of dementia, what are some of the specific issues that caregivers need to be aware of? And perhaps you can explain for us, how these diseases impact the brain and the behaviors of individuals, and how do caregivers cope with this? Maybe I'll start with you, Dr. Gauthier, on that.
Yeah. So indeed, I have telemedicine with the patients who are at home, and the most common question is, what do we do when they are restless, physically restless, because they stay in the house? So if they're able to walk safely with someone, they should go out. The other issue we have is sleep. So this is also true for healthy seniors. We need a sleep routine. Fortunately, most people right now seem to sleep well. It's the exception that we get a request for a sleeping pill or some kind of sleep medicine. We can go back to that specific issue if there's a need later. And possibly Claire has more experience in that regard than me. It's aggressivity. So people who have a nasty character, when they get dementia, it's sometimes exaggerated. Also, old issues with children. Now you're stuck with the child at home, and sort of personality issues flare up. I don't know if Claire has a magic recipe for that.
Let's go ahead.
Yeah, so I guess, I put together a few tips for like best practices with regards to communication skills, taking into account about most people who are isolated right now. So I cannot emphasize enough the importance of becoming educated and understanding what the disease is doing to the person. Because the person that has dementia, they're not saying or acting out or doing certain things on purpose. And a lot of people get frustrated because they don't understand why they're repeating themselves or saying certain things. It's not their fault, it's the disease. So by becoming educated and understanding what's going on, you can anticipate what's coming next. The second thing that I really recommend is to really pick your battles. I mean, we're isolated at home. If your loved one decides to go into the bedroom and change their clothes 5 times a day or empty out drawers, I mean, these are actually activities that are stimulating for them. So if you're spending most of your day at home correcting them and arguing with them, you're provoking arguments right now. So it's really about picking your battles. If they're doing something that is not endangering their safety, then just let it go. Right. And then there's something called the compassionate lie. So a lot of people say, when they ask questions, how do we respond? So if they're asking you certain questions about, if you're a son or daughter caring for a mom or dad whose parent has passed away, and if you're going to tell them something that is going to aggravate them and cause them anxiety, I think you really need to think about how you answer that question. At this time, I mean, what am I doing to them? And then there's also another concept called join their journey. When they're telling stories about who they were or remembering things, if you're spending your day correcting them and telling them they're wrong, I mean, what is that doing? So I love the concept of just joining their journey, encouraging them. And I think most importantly too, you need to be mindful of your own energy. So if you wake up in the morning as a caregiver and you're already frustrated, they're going to feed off of that. Okay. And so a lot of people say, my loved one, they don't want to take a shower. They don't want to take a bath. Well, if you're already frustrated and you're grabbing them and you're frustrated and you're physically trying to get them in the bathroom, I mean, what experience are you creating? So you need to be mindful of your energy because that's what they're feeling. And then the 2 last points I'd like to make is, when there is challenging behavior, when they are off, there's always a reason. And so I feel like you need to be a bit of a detective. When your loved one gets to the point where they can no longer use their words, perhaps they're not feeling well. Perhaps they have, there's something physically wrong with them. Perhaps they've injured themselves. They've got to lift up their pants and see, maybe they're hungry, maybe they're tired, but they can't verbally express it. And, and lastly, for everybody that's isolated at home, be mindful of your environment. Too much stimulation is also very disturbing. If you've got the radio on and the television on at the same time, or if you're caring for an aging parent and your children and dog are running around the house and it's just overstimulation, those are things that could cause, challenging behaviors.
Great. Very excellent advice there. Thank you. So this actually is a nice segue to the next piece on this. Obviously, what you're describing are very challenging times, even in the best of times. Now, of course, we've got a pandemic on top of all of that, and people being forced to change their routines. So maybe I'll put the next two questions together because they really get at sort of the same notion about how do we get elderly people, particularly those with dementia, to cooperate with public health guidelines. The first one is a personal one that came from a woman who wrote that her husband is becoming more disoriented, frustrated, and angry since they have been confined to their homes. She writes, he doesn't care or understand that he can't ride on buses or go into stores anymore. When these episodes occur, he gets angry and accuses me of ruining his life. How can I stop him from this dangerous behavior? What can I do to get through to him? And the second question came from someone from the West Kootenay Boundary Caregiver Support Group. Who is saying that she's encouraging caregivers who are concerned about their seniors to have honest conversations with them about their feelings and the need for them to stay at home. But many seniors who resisted help previously continue to be strong-willed and want to prioritize their independence. Do you have any advice for these situations?
Maybe
Dr. Moret, yeah.
Not easy questions. They correspond to the reality. And there is always ways of coping somehow. I would say, and Dr. Gauthier alluded to it, that you are creating a state of home isolation, but there is also the cost of that isolation, and it is not 100% forbidden to go outside and take a walk. But this would need to be done in the proper way, which consists of maintaining that 2-meter distance and wear a mask if you can. The 2-meter distance is something that is really important. But we can adopt in our present situation afternoon walk that will decrease the anxiety of the person suffering from dementia, your companion, your loved one in this walk. And the risks are minimum, at the same time makes the living more livable. So, and this is in this with this in mind that we have to dose the pros and cons, and because otherwise anxiety will increase, confusion will come, delirium will appear, there is needs to medication, and it engenders a chain of consequences that can be prevented with a simple measure, so as to allow a person to do this walk. The other thing is always in advance foresee what is coming and prepare the person with dementia for the circumstances. So if it is for a bath, if it is for it's time to eat, in advance, a couple of minutes before, tell them what you're going to be doing next and explain why. Because this facilitates, prepares the person. If the person is very resistant, let it go and come back again a bit later. Sometimes it's enough for them to think totally different. These are just tips, and takes a lot of patience and love to be able to succeed.
Mm-hmm. Mrs. Webster, go ahead.
I would also just like to add on to that, if ever a caregiver is in a situation where the person actually becomes physically aggressive with them, they really need to reach out as soon as possible to their healthcare providers or to local community health services, depending where you're calling from or listening from right now. You can reach out to the CLSC for immediate help, because many people don't realize that physical aggression is a symptom of the disease, can become, especially when people are feeling isolated. And the caregiver's life could potentially become in danger. So if you feel that the level of physical aggression is mounting, you really need to reach out for help as soon as possible.
Mm-hmm. So I'm actually looking through all of the emails that we got in, and again, some of them describe some really heartbreaking and difficult situations. Again, I'm not going to go through all of them, but maybe I'll throw out this next one because I think it will speak to the issue of burnout for caregivers. So this came in from a woman who says that she's asking, how can she create a stimulating environment for her 85-year-old mother whose dementia is rapidly progressing during this lockdown? She was hospitalized prior to the outbreak and discharged in my care to protect her from the virus. I'm grateful we're able to get her to our home safely. However, I'm alone with her now, taking care of her from 7 a.m. until 8 or 9 p.m. It's becoming increasingly difficult and challenging for me. I would be grateful for any advice. Dr. Gauthier.
She will find some useful tips from the Alzheimer's Society of Canada website, available in French and English, by the way. Routines should be established, and they do mention, and it's something we know clinically, that familiar odors like lavender, familiar sounds like people who like opera or a certain kind of singing. It could be in their mother tongue, for instance, like Italian. And pictures, so looking at the picture book. This is not specific to the pandemic, it's just general advice about establishing routine, some things that are soothing, either odors, sound, or looking at pictures from the past.
Mm-hmm. Dr. Moret?
If I may, I would add that this person is entitled to receive help from the home services. She should put a call to receive some help, because these helpers now, they are trained and aware of the risk, so they're going to take precautions, because she can get very burnt out soon. The other thing is to consider, is there any family member that she could invite and stay for 1 day or 2 days a week, so that this person can breathe? You can get burnt out very quickly, and having resource to a family member who could help, and home care services in the circumstances is a good thing to do.
Mm-hmm. And I imagine the change of routine must be having a really negative impact. Again, I'm looking at another email that came in from a woman who says that her mom was diagnosed with mixed dementia, vascular and Alzheimer's, and has noticed that since her mom has been unable to go to the seniors center or out on shopping errands with her, or even for a cup of coffee out of the home, that she seems to be more prone to be anxious and to wander around. And she's actually wondering how to deal with this during the quarantine, and what other effects might manifest themselves.
A quick answer is that on the Alzheimer's Society of Canada website, this issue was specifically discussed, and what was suggested is to go on online activities. It's a bit like the children not going to school, but they can reach out to their teacher, or maybe there's a way through Zoom or to talk to other people who that person used to meet at the residence. That can be arranged one-to-one, or maybe there are educational program that this person would be interested in. It could be documentaries, old movies, all available perhaps for free now on Disney Channel. People have to shift from their outside activity to perhaps video, and don't underestimate seniors' ability to be able to use iPad and web communications.
Mm-hmm. So in essence, create a new routine. If the old one doesn't work anymore because you're confined to your home, create new routines using video and other means at your disposal. That's great. Mrs. Webster, at what point does a caregiver need to recognize that they might be in over their head and at risk of a burnout? And how do you address that under these trying circumstances?
So, dementia causes one of the highest level of caregiver burnouts as compared to most diseases, and I know I've experienced it firsthand. And I think first of all, what I want to say to everybody out there is you're not alone. You're not alone, and you need to seek support. So, the type of symptoms you should look for is that, first of all, that when you wake up and every single aspect of your life overwhelms you. So everything is a big task to you. Preparing a meal, getting up, getting dressed, you're just feeling completely overwhelmed. And from the families that I worked with, and from what I've gone through myself, is that either one or two things could happen. Either people fall into a really terrible, deep depression where they really cannot get out of bed, or the other one is you become exceptionally angry. You're filled with fury, like a raging fury. And that's what would happen to me. And, there was a ripple effect, because my fury of how I was feeling, I would take it out on my family. The other sign you should look for is really it's your coping mechanisms. So, we all say, oh, at the end of the day, I can't wait for that glass of wine. Well, that one glass of wine, if it becomes 4 glasses of wine, is that bottle becoming 2 bottles? Are you taking Ativan? Are you online shopping? Is your food addiction growing? And I need everybody to know that these coping mechanisms, it's so easy for them to become addictions. I myself became addicted to wine. And, even though I would always say, well, I need it, it's the only thing I can do right now. And, when this is all over with, I'll be fine. But it took me many years after my mother passed away for me to be fine. So I think that you need to be very mindful of what you're doing to yourself. You have permission to have a life. And if anything right now, because of being isolated, family caregivers need to be sharp. So if an emergency happens and you have been using alcohol or drugs as a way to self-soothe, and you need to all of a sudden go into action and get your loved one to a hospital, or a child is sick or something, and you've self-medicated, that's a problem. So in order to, what I needed to do in order to, try to, limit my feeling of overwhelm was, I really had to take stock of my life and really look at the people in my life or the commitments that I had that were toxic to me or that were taking up too much of my time, because being a caregiver takes up so much energy, takes so much time. And so you really just need to look at your life and say, what's important to me right now? Who's important? And limit that. And the other piece of advice that I'd like to say is, stop listening to other people's opinions, okay? There's going to be always somebody there that's offering you advice, or you feel that's judging you. Listen to yourself, all right? Don't listen to other people's opinions all the time, because it's just going to exasperate and make your own burnout feel even greater.
Mm-hmm. Great. So I do have one question. You mentioned sort of, I guess, medication and alcohol for caregivers. What about medication for those with Alzheimer's? I'm bringing it up because there was a question here. It's a bit technical, so perhaps you'll be maybe less comfortable giving a direct response. But someone is describing the fact that their father is 89 years old with advanced Alzheimer's, living alone with his mother, well, I guess his spouse, so this is the letter writer's mother, who is elderly but in good mental health. But he's obviously feeling the effects of the confinement more so. He's currently taking Ibixa, 1.5 pills or 15 milligrams a day as his main treatment. And they're wondering if they should increase his dose to 20 milligrams a day. And is medication the best solution, or is there any other solutions they should be looking at instead? Dr. Gauthier.
Short answer to that. So the medication you're referring to is called Memantine. It's actually made in Montreal now, but it was initially discovered in Austria. It's a standard treatment for a certain stage of dementia, usually in the moderate to early severe stage. The person at that age is on the right dose. The 89-year-old person has a limited renal function. So the dose is indeed 15 and not 20, which would be given to a younger person. So you have to see what are the specific symptoms now that the family wants to improve. May I just double check what was the main symptom they worry about?
It was advanced Alzheimer's, and she mentions that he has type 2 diabetes as well, which is under.
You want to treat? You have to be specific. Like Claire was saying, a bit of detective work. What symptom is the problem? Is it just occasional, or is it a lot? Does it upset you, the person with dementia? You have to target the symptom. And if you find the trigger, it could be something very simple, like the temperature of the water when you give a bath. It's a very plain example. So the general advice to a question like this is, don't stop the medication, because it is an important one. It's the right dose for that age. And if there's a specific symptom that's troublesome, try to find out what brings it on and modify the trigger.
Mrs. Webster.
I would love the doctors to deal with the topic of wine or alcohol for people with dementia, because I often have families reaching out to me saying that they've been using, wine or beer to soothe their loved one who has dementia, and is this okay?
All right, Dr. Moret, you want to try that one?
Two things to continue, and then I will answer the alcohol in my perspective, is that the medication to enhance memory have little effect on behavior. So even with the maximum treatment for dementia, if there is behavioral issues, we should still need to look after what is predisposing the person to become anxious, to become agitated, to become aggressive, and see what's causing it, obviously. there is certain cases, because of the coping capacity of the person suffering from dementia is limited, we need to introduce some medications that are to do with specific anxiety, depression, and even aggressiveness. In terms of the alcohol, we shouldn't start alcohol de novo, but in certain cultures where it's often taken with a meal, I would say that we can always provide some, probably half of the usual drink that they used to have, because it's part of the culture. But remember, the brain is much more sensitive, so we have to reduce that. Now, never use alcohol as a therapy, because this is where you start becoming dependent, because it's not a treatment for anxiety. And when the effect of the alcohol wears off, then you're more prone to be anxious, including for sleep. There is people who take alcohol for sleep, but we know that after the effect is over, then there is a recrudescence of the anxiety and the difficulty to fall asleep. So this is not treatment for sleep disorders or anxiety.
Okay, great. Thank you for those responses. One more question in terms of seniors living in nursing homes, if I may. This letter writer wrote in that, so he said, both of my parents are in old age homes. Both homes have cases of COVID. My parents do not yet have it, but the fear is there. The patients are now all confined to their rooms. There is no TV, no radio, no stimulation. They just sit and stare at the walls all day. What does this do to their already deteriorating minds? And how can we add some stimulation and joy into their everyday routines?
May I
Dr.
give
Gauthier?
Yes, give them a tablet. They need an iPad or something equivalent so they can communicate with the outside. I think some residences now, they are getting free gifts from donors. So there is the ability to communicate with other people. Any of us at any age, notwithstanding the COVID, would go a little crazy in a room. That's why in prisons, it's not allowed to isolate people for undetermined periods of time. So yes, they do need some stimulation. The ideal one would be with interacting with family members, and second choice would be things they like. We should think about that because it's going to last a little longer. So maybe the families who want to help, they could invest in tablets, so there's more communication that way.
Okay, great. Very good advice. Dr. Moret?
I would just like to add that isolation has tremendous negative impacts on the lives of anyone, but especially older adults. There has to have means of reaching out to them through phones, through tablets, as already said. The organization of the long-term care facilities and residences should rethink and make room for family members to come and visit. I think it's feasible under certain conditions of precautions that needs to be taken, but we cannot leave the older person alone the way things are going up to now. Governments are becoming aware, and they are putting recommendations out to have this effectively done without increasing the risks.
Okay, great. Now, we did receive one question in French from the daughter of a 92-year-old woman. If our English audience members will bear with us for a couple of minutes, I'd like to pose the question as was written in French and ask Dr. Gauthier if he'd like to reply en français. So bear with us for a minute. So she writes, ma maman de 92 ans souffre de démence. Elle vit depuis un an dans un petit CHSLD privé du nord-est de la ville de Montréal, qui pour le moment n'a pas de cas de COVID-19. J'écris tous les jours un court courriel à ma mère que le personnel de la résidence lui lit et lui remet. Je lui redis mon affection, mon ennui, et lui promets des retrouvailles pour l'été. Pourriez-vous me proposer d'autres moyens pour rassurer ma maman et moi?
Je pense que vous faites déjà un très bon travail. Peut-être des téléphones au moins 1 ou 2 fois par jour. Ce serait plus direct, plus personnel. Si elle peut écouter, peut-être qu'elle a un problème d'audition, mais ce serait le conseil évident à proposer.
OK, excellent. Merci pour cette réponse en français. We have a few more questions. We have about 10 or 12 minutes to go, so maybe we'll get through some of these a bit quicker. They're shorter questions. I'll start with this one for you, Dr. Gauthier. You referenced earlier the fact that you are doing some telemedicine with some of your patients. This question came from Shauna Gundy. She's saying that doctors are now doing video check-ins with patients in long-term care facilities. How valid can these check-ins be regarding a patient with Parkinson's or dementia?
Very good question. We have a team working on this across Canada. Richard Camiccioli in Calgary is using video to assess people with Parkinson. And we have at McGill, Maria Guedes, who's trying to validate some of the memory tests that we could use by phone or video link. And in the United States, there's also a move to do that. This will also influence research post-COVID. We will not have elderly people coming for so many visits for research, or perhaps even long-term follow-ups by regular patients. We will be using more telemedicine or phone medicine in the future. That's a positive from the COVID.
Right. So interesting how it may actually change the way that we function as a medical system moving forward, less in-person appointments.
Yep.
On a similar theme, I guess, here's a question that came in from Jacqueline McLaren. She asked, where and when should the elderly get tested for COVID-19? Can they be tested in their own homes rather than having to go out? And when should an older person go to a hospital? Dr. Moret, go ahead.
I would say there is guidelines when a person would need to go to the hospital, when there is respiratory distress or there is so much lethargy, fatigue that they are non-functional anymore. In terms of deciding to be tested at home, it's an alternative, but I'm not sure that the healthcare system right now has the capability of doing that, so we need to wait. The recommendations is you don't need to be tested if you are symptom-free, but you have to remain home and maintain the distancing that have been proposed if you go out, for example. So that's my answer to that.
Yep. Okay, great. Here's an interesting question from Henry Shabata. He says, knowing that the coronavirus is dangerous for seniors because they're naturally immunodeficient, are there any studies on how to boost their immunity?
Maybe I could answer. Unfortunately not. The only thing one can do is to remain physically active despite the circumstances, eat balanced meals. I think it can help to maintain our immune system. And the rest is to accept that none of us are perfect, including our immune system, to fight this virus.
Okay, great. Here's one from Vicky Shemi. She wrote, firstly, I'm so grateful and fascinated by these webcasts. Thank you, Vicky. Her question is, would a drug such as APO residronate, taken by a septuagenarian for osteoporosis, affect the immune system in any way?
Well, I don't think that there is any study determining that residronate would be detrimental to our immune system. So I don't see the link, and the health benefits of maintaining good bone health using this drug is such that I would recommend to continue, no doubts. There is precautions to take, however, because after taking the drug, they have to maintain seated or upright for a minimum of an hour. So this has to be followed.
Okay, I've got two more from our alumni. Here's one. At what point is it safe to visit a loved one in a long care residence after you've been diagnosed with COVID-19? Dr. Moret, you seem to want to jump in.
Again, there is public health recommendations for that. You have to abstain being in contact with anyone, direct contact within 2 meters for 14 days after the beginning of the symptoms. So this has to be respected with great attention, not to contaminate our environment, and other persons will fall sicker than you might be.
Okay, and maybe we'll end with this question from our audience. I really like this one. It came from C.I. Petros. And he's asking, is there anything that can be done to slow the onslaught of dementia? Any medicines or exercises? Dr. Gauthier.
It's a big question that we've been working on for 30 years. The short answer is if it is Alzheimer's as a cause, instead of strokes or Parkinson, So if it is Alzheimer, the most common cause of dementia over age 65, you have to remain physically fit and active and interact socially. You have to treat other conditions that you have, like diabetes and depression, and you try to be in perfect shape as much as feasible. Everything else is experimental, so there's no special diet right now that is recommended as delaying progression of Alzheimer. There's a lot of research going on in combining physical exercise with cognitive training or keeping your mind busy in a special way, and perhaps some diet supplements. This, unfortunately, is all on hold. All the research on prevention or delaying progression of Alzheimer's is on hold worldwide. But people are talking every week how to improve these projects when they get started again. As I said earlier, there will be easier ways for people to come for the visits. We'll do it at a distance. Some of the things we were planning to do, like physical exercise, cognitive training, may be switched to video casts. There may be ways to send medications that if people are trying a medicine to prevent worsening of the dementia, there may be ways to send the medication in a safe way to the person's house instead of the person coming to the hospital just to pick up pills. So there's also a positive outcome for preventive research in the field of dementia out of all this.
Okay, great. It sounds like we may have to have you back for a separate webcast just on Alzheimer's and dementia once we get past this pandemic. Before I let you go, I do want to maybe get some of your thoughts on sort of maybe the bigger picture of what we're looking at here. So obviously, we've seen a devastating toll that this pandemic has taken on the elderly, and in particular those in seniors' residences. But I think it's also shown a harsh light on some of the ways that we as a society at large may be neglecting the needs and the dignity of our elderly. And I'm just wondering from each of you, once the pandemic has passed and we can resume a semblance of normalcy in our lives, do you think that this experience will force us to take a harder look at how we treat our seniors, either by compelling us to reimagine multi-generational family structures, or maybe rethinking the need to invest more substantial resources into the care of our seniors? So we can go around, I get each of you to just sort of weigh in on, the longer term impacts that this might have on us as a society. Dr. Moret, do you want to lead this?
Since you appointed me to start, my answer would be, I hope, and already we have received some promise by our provincial government that this would be the case. There was a crying need to increase the number of orderlies to deliver the care, especially hygiene and food, so that our older persons living in long-term facilities will receive all the basic care they're entitled to, plus, if possible, a little bit more love and attention. So I think these present challenging circumstances will serve as a way to remind us we have to devote more resources to the older people.
Okay. Dr. Gauthier.
Well, this is a game changer. As a baby boomer, I think our group of people at risk for the next generation of people with cognitive decline and the physical difficulties will have a hard look at where we want to be in 10 or 20 years if we have disability. We do have time to think ahead. So my short answer is yes, this is a game changer event, and it will be perhaps for the better for the people who currently have disability, but also for people who are still at the age where we can prevent such things happening and where we would like to be if it happens to us in 20 years.
Great. Wonderful. And Mrs. Webster, how about yourself? Any thoughts to conclude?
Well, one of the reasons I became a certified Alzheimer care consultant was because I had recognized the challenges in the system way back when, beginning in 2006 when my own journey began. And, without a doubt, as a society, we need to mobilize together to ensure that, our seniors are definitely better well taken care of. And I'm incredibly grateful that, for instance, I'm an ordinary citizen that approached McGill University and had this idea of starting this program to educate family caregivers. And the university just embraced the idea. And I really, I encourage all the family caregivers out there who have been through tough journeys or are going through tough journeys to just you're learning so much right now, and you will have friends whose loved ones will be diagnosed tomorrow, and you could share your knowledge and approach your municipalities and approach your governments and approach, the educational systems, and start your own crusade the way we're doing at McGill. This is really an opportunity to change, but it really takes an alliance of all of us together.
Great. Very well said, and probably a good note to end this wonderful and fascinating discussion on. Thank you all very much for that. And I think as we look at society, and you mentioned, Dr. Gauthier, in particular, the baby boomers, there's a huge number of people who will be getting into their 70s and 80s in the next few years, and obviously life expectancies are increasing, so people will be living longer. So I think it's something that society will probably need to take a very long, hard look at post-pandemic, in terms of making sure that all of our seniors are treated in a better way and with more dignity. So thank you for all of your words on that. That about wraps up the time that we have today. But before we close, I would like to remind you that this video will be available at this very same link soon after our recording ends. So feel free to share it with others who may not have been able to tune in live. And please keep watching your email and social media feeds for more information about how McGill is confronting the challenges of COVID-19 and keeping you informed with insight from our academic and medical experts. If you are a McGill graduate and are not currently receiving our emails but would like to be added to our distribution list, you can visit alumni.mcgill.ca/register, and we will post that link in the bottom of the YouTube video description, as well as a bunch of other resource links that our panelists referred to just now. And of course, I would like to extend a sincere thank you to our three guests, Drs. Serge Gauthier and José Moret, and Mrs. Claire Webster, for taking time out of their very busy schedules to join us today and for providing us with such important information about caring for the elderly. It is such a critical issue during this crisis, and I appreciate you all making the effort to share your insight and guidance with all of us today. If you'd like to hear more from our experts, they have developed community workshops to educate and support family caregivers who are looking after a loved one with dementia. Although the in-person workshops are, of course, currently on hold, you can find out more information and sign up on the waiting list at mcgill.ca/dementia. And again, we'll post that link as well in the bottom of the video description. And thank you, of course, McGill alumni, for tuning in today. Please be sure to join us again on Thursday in our usual time slot as we look at the history of pandemics through the eyes of a McGill history professor who has studied cholera, smallpox, and the Spanish flu, and a scientist who came of age as a researcher during the HIV/AIDS epidemic, and who is now on the front lines of COVID-19 research right here at McGill. It promises to be another fascinating discussion. Until then, on behalf of all of us at McGill's Office of University Advancement, please stay home, stay safe, and be well. And see you on Thursday. Thank you.